Hi, my name is Shervon Laurice, and I am a licensed psychotherapist and a certified cannabis-assisted psychedelic therapist and yoga therapist. And I'm the founder of Restore Tranquility, which is a therapy center located in Silver Spring, Maryland. I have been a therapist for now 20 years and have worked with hundreds of people over time, primarily with depression, living with anxiety, PTSD and complex PTSD, as well as chronic pain, particularly autoimmune disease like fibromyalgia, lupus, and so forth. And in my work with people, I've noticed that there is often a thread that runs through many of my clients' stories of feeling a sense of incompletion, feeling a sense of being stuck in their lives in some way, whether in the personal field or in the professional field, um, and people looking for change, healing, transformation in their day-to-day lives and not sure really how to get there. I started my practice almost immediately after my graduate studies, and I wanted not to necessarily work for an agency, but really wanted to be able to have the freedom that comes from owning my own practice and being able to work with the kinds of clients I wanted to work with, rather than being assigned random clients. And so when I started off in a small little space in the basement of a church, of a local church, where I didn't even have to pay rent. They said I could pay by donation from a small percentage of what clients were actually paying. And if clients were being seen pro bono, then I didn't even have to pay for those clients, which was great. And it gave me my footing in the first couple of years. And then I moved on to an actual subletted rental space in which it was a small, again, office with no windows, but I was there for 8 years working one-on-one with clients, and then added yoga therapy to my practice of working with people in the counseling sphere. And why I started offering yoga therapy once I finished a yoga therapy training was particularly with clients who have anxiety, PTSD, and autoimmune disease. The breath is so powerful. The breath is something that goes with us anywhere and everywhere. And in our wakefulness, we can use as a tool to help us manage our stress and our anxiety in any given moment. And so I started to give people breath practices to help them when they were not in session, to be able to manage anxiety, panic, and so forth. And then later, flash forward many years later, I completed my cannabis-assisted psychedelic therapy training, and I am now able to offer people a more advanced way of healing trauma, releasing tension in the body, finding ways for people to get unstuck and to become the creators within their own lives by stepping into cannabis-assisted work, which allows for the broadening of one's consciousness. It allows for the healing of old wounds and old traumas. It allows for people to step more fully into their present life by bringing them to present-centered awareness so they can make the kinds of decisions and changes that are lasting and sustainable in their lives to move forward. Nowadays in my practice, I would say that I tend to be more eclectic in my approach. My training was closer to cognitive behavioral therapy. And over time, I started, in working with clients, I started to stick with just one way of working with clients meant that I wasn't always going to be offering them the best solution to where they were right then, right now. And so I started to take a step back and have a broader lens on my work with people in general. And now I can meet with a client the first couple of times and start to get a sense of whether or not they really do need and would benefit from a cognitive behavioral approach, or whether it would be a more mindfulness based approach, or suggesting, hey, maybe in the work that we do together, based on what you've presented so far, we can do a combination of talk therapy and yoga therapy, or move from talk therapy into cannabis assisted therapy, so that they can get the full benefits of what it is that they want to achieve, the transformation they're looking to achieve in therapy. I think having a broader approach allows me then to also not slow down their process. Psychotherapy is traditional talk therapy. It is oftentimes theory-based, and people come to talk about the things that they're working on in their lives, the problems or struggles or the stuck areas of their lives. And me as the psychotherapist, I am like the third party, so to speak, the neutral party in their lives, and can maybe with conversation, questions, help them to get to a place where they can see things differently, have a different perspective on what's going on or coming up for them, point them in the direction of helping them to make a new, more sustainable decision or a lasting change or action in their life. So psychotherapy is this wonderful way of allowing people to talk and come really to their own realizations and understandings, shifts and changes. And I'm just there to facilitate and walk them through it, or walk with them through it. With yoga therapy, it is a process of taking a look at the whole person, mind, body, spirit, and finding out from them what their point of transformation will look like, what they want for their transformation, so that I can combine techniques of yoga, whether that be movement on a mat, asana, breath work, which is a powerful way to move the energetic body that we all have through the breath, meditation, which is calming the chatter in the mind, yoga nidra, and so many other techniques in yoga. Using all of those techniques, especially in concert with psychotherapy or talk therapy, allows a person to then move their needle that much faster. When you can gain clarity because of breath work and meditation, or heal the central nervous system because of a daily yoga nidra practice in concert with the talk therapy, then you can talk about the things that come up in these yoga practices and move yourself along. It's a powerful tool. The third modality is cannabis-assisted psychedelic therapy, which is a process of using cannabis in an elevated way. It is taking the cannabis sativa and pairing it with preparation and intention, and then moving through a process of using cannabis based on the intention that is set to move someone's evolution, transformation, and healing along. Cannabis sativa we all know because it's been used recreationally in our country for many years. But before it became a recreationally used plant, it was something that was used in communities around the world as a medicinal healing plant or a plant that brings about more awareness and consciousness for the mind and mental healing. And so, what we now know about cannabis is that when you can use it in a container of preparation and intention, and you use it in a blend, bringing many different strains or several different strains together in one sitting or one session, you can then have this deep dive into the subconscious or the unconscious mind to be able to bring about healing, to be able to untie the knots that keep us stuck. It helps us to heal some of those physical body tensions, as well as to get new clarity and healing on some old trauma, some old wounds that we may still carry within our bodies and within our psyche. Um, and from there, having those sessions, we would then move into integration, which is the second parentheses around the process. And integration allows you to take what you've experienced in those sessions, process it for more clarity, understanding, seeing what pieces of what you experience make sense for you to bring into your everyday life so that you can make changes that are lasting and sustainable. And in the days and weeks and months, maybe even possibly years that follow, you have these moments where you can pull from that experience and integrate and bring into your life based on what you now know about yourself, the way that you've changed yourself through new perceptions, new perspectives, and the healing that has taken place. So those three things together, I feel, are the trifecta of allowing people, guiding people, facilitating people's process into becoming their full selves, the true selves that they were meant to be, the creators of their own lives.